Ladies and gentlemen, up next we have another presentation, and the topic is the future of healthcare. To present, join me in welcoming on stage Dr. Sujit Paul, Group CEO, Zota Healthcare, Dava India. Ladies and gentlemen, let's put our hands together and welcome on stage Dr. Sujit Paul.
Gentlemen of the House, my fellow colleagues, ladies, gentlemen, and my good old friends from RAI. It's always a pleasure, when I meet my friends in RAI because that's where I think all of us belong from. I am part of this phenomenal piece of store that you're seeing. However, today's topic that has been given to me is future of Indian healthcare. As I speak for the future of Indian healthcare, I would bifurcate the entire discussion towards where we are now, what we should do, what we and the country is doing at large, and how do we see it in the progressions ahead. I've been given 10 minutes time. I'll ensure to finish within kind of 8 minutes and leave kind of 2 minutes for a Q&A over I start. As I speak, the largest challenge that India at this point of time is facing is to ensure that affordability is taken care of. That's a bigger challenge. In this room, as you stay in an air-conditioned environment, you cannot understand and see the magnanimity of the challenge. And there is where we are working for. The larger story is that when Indian urban and rural in large really cannot afford expensive medicines, more so when they have ailing patients, when they have geriatric parents, when they have chronic ailments at home, like cardiac, gastro, peds, diabetic, nephro, so on and so forth. When the average bill value of an average diabetic patient goes up to as high as 7,000 to 8,000 rupees, there's a challenge. If you, me, and other leading corporates cannot work on the challenge, I think India would not see the light of building healthcare as what it should ideally build as a healthcare ecosystem. It's a great idea to speak about enhanced selling, to speak about artificial intelligence, to speak about machine learning. Trust in me, those people who are close to at 95% of the population of the land of India, they don't understand any of these jargons. These jargons are for us who can afford to understand, listen, and speak on these jargons. As I stand and as I work for the mission that India needs today for healthcare, we work extensively in the rural villages. We work to understand that the mother who cannot afford the medicine of his son, and when the son is having high fever, is where we all need to work on. And that is the future of Indian healthcare. Do you agree or do you don't disagree on this? We all agree on this? That is where we need to work. Unfortunately, we get lost on the glitz, glories, and fancies of what we helm at. But that's only less than 1% of the entire ecosystem for the land of India. Check the dynamics and the data that we speak about. That is what is the future of Indian healthcare. When a clinician or a physician gives medicine morning, evening, night, they break the pill and take just because they can't afford those medicines. There is where we are working to ensure that till the last village, till the last pin code of India, everyone can afford those high-end medicines at a very, very low cost. That's the generic medicine revolution that India is undergoing at this point of time. Unless you believe in this, neither you can feel nor you can do those businesses. A business house need not only run for the financial numbers. A business house should and ideally first run for the value that it creates. That is what should be the future of Indian healthcare retail. As I spoke on more of OP or outpatients or on medicines, I also need to speak on the hospital structures. Whilst we have large hospitals in the urban and rural, but what is more required is secondary and tertiary healthcare. What is more needed is people who can even give a basic injection. What is more needed at this point of time for a future Indian healthcare is to have subsidiary clinics and individual clinic mechanism systems with a telemedicine consultation and a tele-ICU movement for the villages. That should be connected with the larger hospitals that India have. It's a sad state of mind that Indian corporate hospitals are yet to understand the pain that is undergoing in the villages, but that's not what is the future of Indian healthcare. The future of true Indian healthcare is not when you do not understand the pain that they can't afford. For a simple appendix operation, people have to travel more than 100 kilometers in rural India. By the time, there are a lot of mortality that happens. For a simple delivery of a birth, a cesarean delivery, people have to travel at times more than 150 to 200 kilometers to get into a cesarean delivery. Unless we sort out these basic problems, it's no good for any one of us to work on the financial numbers only. Financial numbers are the derivative of what you truly believe. You and me have the power to change. And if we truly believe in operating on this change, then is when we will have a better India for tomorrow. India is growing. That's fantastic. We are all working on that. But what is also needed is to work on those 98% of people who don't even know that what growth means for India. They don't even know the full form of GDP. They don't even know what is actually happening on the glitzy story of India. If we work on the healthcare for them, then that's the future of Indian healthcare. I've spoken close to 7 minutes. As I speak, to summarize, I think it stands as a responsibility for all of us here to ensure that we build an ecosystem, and we see an ecosystem where the urban and the rural work hand in hand with the modern technologies and with the right belief system of the corporate houses to make a true dream of a healthy India. And then we build a world-class Indian healthcare mechanism. Thank you so much. Open to any questions, 2 minutes I have in hand.